Surgeons have taken different approaches to mesothelioma. One approach is that surgery itself can't really affect cure, so that surgery shouldn't even be used. And in this circumstance, what some surgeons do is they look inside the chest, they drain any fluid, and then they put talc powder, which irritates the inside of the chest and fuses all the surfaces together so that the fluid can't come back. Now, this is not really a treatment for mesothelioma. All it is a treatment for the fluid and the symptoms of mesothelioma, so the cancer treatment is then relegated to chemotherapy only. There are other surgeons who take a very radical approach where they go into the chest through a big incision and they virtually strip the mesothelioma tumor off of all the surfaces and onto just the lung itself, and then they take out the lung. Now, the lung is really an innocent bystander underneath the tumor, but they take it out in order to theoretically get a better clearance of tumor. And then there's a third approach, which is called a pleurectomy and decortication. And in this approach, you still open the chest and radically remove the tumor from all the surfaces in the chest. However, instead of removing the lung, you basically scrape the tumor off the lung as well. And this can actually be done very completely, so it gives you just as much tumor clearance as taking out the lung, which is called an EPP, or an extrapleural pneumonectomy, and it does so with much less sacrifice of lung function and risk of having surgical complications that result in bad outcomes and even death.